Everyone, I'm Sai Shankar and welcome to White Coat Blueprint. Today, I'm thrilled to be joined by Dr. Chesney Castleberry, a pediatric cardiologist and an associate professor at Dell Medical School, serving as a medical director of the Heart Failure, VAD, and Transplant program at the Texas Center for Pediatric and Congenital Heart Disease here in Austin. Dr. Castleberry specializes in managing complex end stage heart failure, transplants, and mechanical circulatory support for children. Thank you so much for being here, Dr. Castleberry.
Yeah, and thanks for having me. Yes, again, I'm a pediatric cardiologist. I take care of kids before and after heart transplant, which often includes kids who are on mechanical pumps or the VADs, which stands for ventricular assist devices, as well as kids who have heart muscle disease or cardiomyopathy, including those who have, hearts that don't function very well, but also kids who have heart disease that maybe their parents had, which causes their hearts to be thickened or stiff.
Wow, the work you do is truly amazing. And could you tell us about your path into medicine and what truly inspired you to pursue it?
Yeah, so I grew up in Texas. I grew up in a rather small town. My dad was the local veterinarian. He mostly did large animal, and we had a ranch, and I was involved in the cattle, raising cows and showing cows and that whole thing. And he also had a vet clinic that was about a half a mile away. And so I spent my time, taking care of animals in the kennels and helping with procedures with the small animal vet that he worked with. I spent a summer in the vet clinic doing a lot of the vet tech role, which, was an unlicensed role back then. Now I think they have more trained professionals doing that. And I decided that summer that I loved healthcare and taking care of patients, but I wasn't quite into the world of veterinarian. And so I was also attending a magnet high school called Health Careers High School in San Antonio. And that was when I became more interested in medicine. So I did go into college already kind of knowing I was on a pre-medicine track and wanting to go into medicine.
That's so impressive, Dr. Castleberry. And I see that you have this long path. I mean, like, you were very passionate about it, right? I mean,
Yep.
it looks like you have a lot of family background and as well as your own passion for cardiology. That's truly amazing. So what is different about caring for children with serious heart conditions compared to adults?
In kids, obviously your patient is still the child, but your patient is also the family. And for whatever reason, came easy to me. People often associate pediatrics with the veterinary medicine of the human world because your patients don't talk to you, and you're often dealing with this case instead of owners and patients. And so I don't know if it was that exposure that attracted me to kids, but I think there's a lot of resiliency in children, and so if they feel better, they're out playing. If they're feeling bad, they're laying in bed. And so for me, that was quite easy to just be able to walk into a room and see how someone was doing based on how the child was interacting with their environment. And so that's kind of why I fell in love with pediatrics. I also enjoyed physiology. So I did a physics class in high school again, had opportunities there, and found that physics came easy to me. So heart failure is a lot of just physics, fluid dynamics, pumps not working, how do you fix it? And so that was kind of why I gravitated to heart failure and transplant, is because of that exposure as well.
Okay. Very amazing. Actually, right now in high school, I'm not a
Mhm.
very big fan of physics, and yeah, I think it's very interesting. So, in pediatric cardiology, how much of your work involves planning for a child's long-term future? Like in the future, like how do you know, your your patient, how does it impact them in the future? Like, do you look at long-term or just short-term?
Well, let's go back to what you talked about with the physics, because I think there's an important learning point for your kind of colleagues there. So everybody thinks they have to like doctors fit in a certain bucket, or going into healthcare fits you in a certain bucket, and you have to like certain things or dislike certain things. And what I would say to that is, it's really such a diverse field that following what you love. So for instance, physics was great for me, but memorizing things, so like anatomy, was very hard. And so just because you have, difficulty in one subject, or one subject is something that you're like, oh, I don't really love that. I would say just keep an open mind and keep working towards things, because, when you find that little, I'm very niched into a world in cardiology, but I gravitated to that niche because of my strengths. And a lot of other people's strengths gravitate them. So for instance, infectious disease docs are like the walking Encyclopedia Britannica of our field, because they have just this kind of catalog of all this knowledge, and that was not me. And so you just kind of find what you're good at, and what you're good at usually brings you joy. And so just following what brings you joy. So that's what I would say to, like, when you like something or you don't like something, it doesn't, a lot of times the field's so broad that those little things don't matter. But if you enjoy helping people, that's the biggest part of choosing this career pathway, is really wanting the desire to help someone else, because it's while it sounds like great on paper and it seems like, oh, this will be a great job, it's a lot of work and a lot of sacrifice. And so I think that fundamentally is more important than whether or not you're good at math or science. A lot of people, there's a lot of physicians who are not good at math or science, and have they're into the humanities, and there are places for people who are more into that kind of realm as well. So I think keeping that as a there's no one perfect formula for a doctor. It's a very wide group of people with diverse strengths and weaknesses that really makes the teams work well. So then you asked about long-term, what do I think about for kids? I think a lot of it, my field is a little different. Kids usually come in to see me when they're very, very sick, and we're trying to sustain life. And so I think we often are just trying to fight the battles in front of us versus the battles in the future. But I do think we try to set up a relationship with them that especially a healthcare professional, somebody who has chronic medical illness, making sure that there's a good relationship with the care team, knowing that relationship has to survive in order for that patient to be good long term, so that you kind of become part of the family, if you will, and making sure that that's always kind of a priority for them. It's not just we'll just patch your heart up and you'll be done. Usually somebody who comes to me along these pathways, they're with us for life, and that really trying to get them to accept that change in a normalcy, if you will, is important, and the trust is super important.
Yeah, you mentioned how each condition is unique in each child, right? So when it comes to congenital heart conditions, they're unique in each child. And how do you prepare for where cases are different between two individuals? Like, how do you prepare them?
Well, I think that's one of the reasons why I fell in love with this field in particular, is that it's not just one person making one decision with one patient. We are a team, and every member in the team is very valued. So we have nurses, pharmacists. I work closely with surgeons. I just got out of a meeting where there was 100 people in the room making the decisions for the day. And so I think because it is very heterogeneous and every child's different, and some of them are quite sick, that it really it's not just a single person that makes those kinds of calls. It's a collaborative effort. And with the more heads better than one kind of philosophy, we come to a decision that we all feel is the best. And sometimes I'm more in agreement with some decisions and less in agreement with others. But it really is the group work that kind of, I think, ultimately at the end of the day is what's needed to make sure each kid does well.
That's amazing. So when I think of cardiology, what are some specific, what are some current challenges that is specific to pediatric transplant programs today that you're seeing?
I think our biggest issue right now is just the changing healthcare environment. funding for, expensive things like our if somebody comes in and their heart doesn't work, that's a very expensive problem, becomes more and more difficult. We're having to become more and more creative with how we word things when we're asking for, I mean, almost every patient gets a letter of medical necessity that goes to our insurance company that then needs to be agreed upon prior to starting any care. And so for me, I think the biggest challenge is just the changing healthcare environment. The expensive things is becoming probably unsustainable, and is a problem that's going to be for our future generations that we've kind of dumped them with. But I think that the system right now is a little broken in the sense that we keep coming up with bigger and better ways, fancier new toys, but we really haven't thought of how to pay for them and how to be equitable in how they're used. And so there is a lot of emerging, worsening, socioeconomic disparities in the field. And so I think that's kind of the biggest challenge. It's really not the medicine. The medicine keeps getting, I have new therapeutics, that I haven't used. I feel like once or twice a year, we're coming up with a new drug or using a new drug that the adults are using. So it's really not the technology, it's the ability to implement all of those equally for all patients.
Yeah, you talked about how hearts sometimes they don't work in patients. I feel like being an expensive problem that is, I think it's also a very emotional situation for parents and kids, obviously. So how do you communicate serious risks while helping families feel supported and not overwhelmed?
Yeah, I've kind of have a style that's pretty direct. I make the joke, when I see some families are like, you don't really want to see me, but if you need me, you want me, kind of thing. So, just being very open and honest about what we know and what we don't know, about how we came to a conclusion about what our recommendation is. It is a shared decision making a lot of times. The first thing I say when I'm talking to a family for a transplant, I'm like, the first thing is you don't have to do this. And so here's the risks, here's the benefits. But just trying to really always have a very clear communication. And if I'm thinking something, I'm always better off saying it versus holding back and trying to a lot of times people more is like, like trying to skirt an issue that maybe is controversial or difficult was worse than trying to deal with it directly, especially in a healthcare environment, because if things are going on and people are talking about things, it's going to get back to the patient. And so it's always best to be the first person who tells them that and tells them what we're going to do and what we can't do and what we know and what we don't know, and just always try to make sure they know we're doing our best. It's still a very challenging when it comes to a kid, especially, and because we don't. While we have good tools, we don't have all the tools, and the scarcity, especially when it comes to getting a new heart, is pretty large.
What patient interaction changed how you see people?
I think it's all of them, like each one of them is a little bit different. You take from it, some, obviously more than others. You get closer, just naturally, just like people like some people more than others. You kind of gravitate to certain families and become connected with them more. But they're all very different. And I think, having an open mind and learning from each one of those just makes you better. I think, again, that practiced art of, tough conversations. I always, after I have a sit down with the family where we're going through things that are very difficult, I always ask my colleagues, in the room, especially social workers and chaplains and all that. I was like, okay, what was good? What could be better? And just always being open to each one of those interactions. Because again, there's still kids that I think about all the time, both positive and negative. And there's some that, I haven't thought about in a while until you're like reading a list of patients. But I think really trying to take from everyone these little pieces, and that's what continues to make you evolve as a physician.
Yeah. And as a physician, I think like your biggest responsibility is like managing patient care and as well as like, treating, emotionally balancing them, right? And I mean, this sounds really hard. Like you have to stick with them during their most vulnerable time and also help them out. But don't you feel this emotional weight also on you that like how do you manage that? Like how do you manage the emotions that you face in the hospital and also your personal life?
Yeah, I have lots of hobbies. My husband is very patient with all of them. I found that, even having chickens and going out and feeding my chickens when I come home is my transition zone, so that I can compartmentalize, work and home differently. I exercise a lot. That's the other way of, kind of managing with the emotional, because again, what I do in particular is more on the emotional drain than I think. Not all physicians have that issue, like obviously, there's, anytime you're dealing with patients, you can have bad outcomes. But there's certain people who sign up for more of it. And I'm on that other extreme. But yeah, I think naturally I was able to do that better than a lot of other people. So maybe that was one of the reasons why I also was gravitated towards heart failure and transplant. I didn't want to be the person who like was trying to find the needle in the haystack. I'd rather just all the needles came to me. Like I felt the the fear of missing somebody who had a cancer or had, some other kind of major disease and then they didn't survive that to me was not what I wanted to be doing. So again, it's a little bit nice to be on this end of the spectrum where the train wrecks are already established. And you're just kind of trying to manage through that. But I also, whether it was because at a young age, I, was with animals that had passed away, or that was part of what I did as a kid. Whether or not that was easier for me to compartmentalize or not, I don't know. But I definitely have worked on trying to make sure that I'm able to continue to be balanced when it comes to, having fun with my family when my family's around, and also being able to leave the stuff that happens at work at work, which some people again navigate that well and others need a lot of help. And I found a lot of hobbies. My hobbies are what makes me. I bake bread, I cook a lot, I obviously have animals like crazy, and so I have a lot of those healthy outlets to try to make sure that my home life is very happy, and my work life, that makes me, whether it's good or bad, I can deal with it because of the offset with home.
That's truly incredible, Dr. Castleberry. It looks like you have like the perfect balance, and I think that's very hard to get. You know what I mean? Because some people, like even for high schoolers and college students, pre-med students, they find this they don't have a balance between their personal life and their work or school life because yeah, it just gets interlinked and it's just all messed up. So I think it really takes a certain amount of skill to manage that and just go with the flow. So
Well, I think balance is in the eye of the beholder, though. You know what I mean? You could look at my life and say, well, you work this many hours, that's not very balanced. But for me, it's balanced. And so I do think,
oh,
again, like, if you're, working, a lot on your schoolwork and you're happy with all that and you're, like, the balance piece of things, I think we were like, oh, I'm not out with friends, I must be, not having a balanced life. That's bad. I mean, it really is all in the eye of the beholder. And so I think there's a lot of stress to like, you know, like that term makes people nervous and like you're doing something wrong. And it's really not about what other people think. It's about what you think. And so while other people might look at mine and say, oh, well, that's not very balanced. You've worked 80 hours this week. How's that balanced? For me, it's fine. And it's not all the time that happens. And so again, I think, we put a lot of emphasis on those thoughts, even when you're at your age, and learning how to like just be happy with what you're doing is more important than any kind of balance.
absolutely right. So if you look at like the internet or any social media platform, it's always doctors working crazy hours. And like I think that's how medicine is usually portrayed, that physicians and surgeons, they work long hours and it's a very stressful field and it's very high demanding. So how do you feel about that? Do you think that's right?
I think that there's opportunities to have more of a structured timeframes. Like you look at an emergency room doc, they're more shift workers. There's lots of shift work opportunities now for people who that is a priority. Again, it's all about what you want. For me, that wasn't where my passion led me, wasn't to a place like that. And so, I also worry that we've set ourselves up for like more disappointment if that's what you think is needed in order to be a healthy individual. Hopefully, I'm proving that you don't need that. You can work insane hours and still be, tick all the boxes if you want. And so we also there's a lot of other fields where you work, you look at a restaurant industry, you know what I mean? And I just read a story about how they're closing a family restaurant because nobody wanted that kind of lifestyle. And so it's not the only one that is that way. In fact, I look at my dad's hours and he still is crazy even in his 70s with how he works. And so maybe it's kind of a inherited, but that's what I saw and that's what's normal. And I feel like we try to model that for our kids, that just because you're the hours you work doesn't matter as much as it's what you do when you're not working. And so while I do think there still needs to be some, you shouldn't be working 36 hours straight, which on occasion I do. There's some balance there that may be needed. I think in general, again, we're very fixated now on those terms, and maybe we've gotten too fixated on it and coming back to something where it's more the individual choice. I think an individual should be able to choose, and they should be able to find what they match with that it allows them to be what they want. But I don't think necessarily, having it always a certain, time in, time out type thing is going to work either as realistic.
Yeah. I feel like also doctors, long working hours, I think people only see the stress and the long working hours, but what I truly see is the passion. Like, you love doing something so much that you're ready to spend all your time and energy into it. So I think that's amazing, right? That's why I respect this profession so much, because you make direct impact on people's life, and at the same time you do something you truly love. So I don't think medicine, it shouldn't be about the title, it shouldn't be about I'm a doctor, or that it shouldn't be like a proud factor. It should be more on your passion and whether you like it or not. That's it. So you even mentioned how you didn't want to take the emergency room or those kind of fields because you didn't want to. That's it. You were passionate about treating children, and you saw your father growing up, and I truly respect him because he loves what he does. So that's why he does it every single day. And I think there's a saying that a musician never really retires until the music dies in him. So it's something like that. The passion, you work till your passion dies. So and when we think about physicians, I think they also have a lot of misunderstanding. Like, a lot of things are misunderstood about physicians, right? So what do you think that high school students or pre-med students are often misunderstand about the path of becoming a physician?
Well, I think, if I knew then what I know now, it is a long journey. I think make the joke about stopping counting after the 20th grade, was kind of the joke, especially if you go into a field that is more niche. There's always another, set of expectations and things that you're doing. So I do think it's, kind of knowing that mentally. I wish I would have taken a break in between at some stage. I always talk to pre-med people, and I'm always like, yeah, if you're needing a gap year, take a gap year. I feel like that's one of those things that I think is very healthy, because what's one more year when you're talking about 25 years of education, when you add it all up. And so I think that was something that if I would have, again, could go back, I would definitely have done, whether it's the gap year between high school and college or college and med school. Because once you're in the med school track, you're done. You're not taking. So I have a plan for a gap year when my son goes to college. So we've got a gap year planned, because that was, again, one of my biggest regrets. And so we're going to take a year off and come back and see what to do after that. But I think that would be the biggest thing, is to, make sure that, it is a long haul. And if you need a year of doing something completely different, that's great.
That's amazing. Also, looking back at your training, what part of medical education challenged you the most?
I mean, we were still very in the, you know, testing to like right now, we have computers at our fingertips. And so education has changed, medical school education included, has changed to not being able to recall as much and being able to problem solve and find answers. So for me, the recall was always the hardest thing. Like I strayed away from things that required a lot of recall. But the experiential learning, the physiology type of things was my pathway. So again, I think a lot of that, if I could go to medical school now, I'm sure I would find it a lot more easy because, you don't get taught facts, you get taught how to find the right information. And so it's a very different world that even if you look at, 20 years ago when I was going through it.
So yeah, how has pediatric cardiology changed over time? Like, I see that you've mentioned a lot about that. Like, as in you work with VATS. I mean, as in you treat a lot of kids who need VATS and heart transplants. So, what technological changes do you see in medicine right now, and how do you think it's going to impact the future of medicine?
Yeah, I mean, I think the AI piece of things is going to make things even more different. Connecting the dots was always hard. Somebody who was always reading journals, may come across a nugget somewhere and then be able to apply it to their field, but that's not the reality for most of us. So I think AI will do that for us. I think we've become more reliant on technology. Like our pumps are more sophisticated. Our integration with electronic medical record is very different. Having things embedded in EMR systems to alert us when a patient is cardiac arrest or whatever it is, I think we'll continue to see. I think the like what people do at the bedside will also change. We see robots running around all over the place trying to deliver stuff to different items, and I can see that evolving over time. And so I do think it will look a lot different in the future. And for that next crew coming up, I feel like a lot of things have changed for me if I look back at what I was doing. Again, I started with, we wrote every order for a patient. If a patient needed Tylenol, you wrote it down and then you signed your name. And now all of that's done electronically, just in my short career. And I can see how that advancement will be much, much bigger as we look forward. As instead of coming up with an order, the computer is going to prompt you with, your patient's heart rate is this. Do you want to start this medication? And some of those things. And so I think it'll be interesting to see what happens.
Do you ever feel like AI will take over medicine? Is that a possibility? Do you see that coming anywhere?
I mean, I think people will always trust people. And a lot of what I do every day, I mean, I always laugh at like 80% of what I do on a day is medicine, it's problem solving. So I don't see how that piece can be necessarily replaced, but there's the adage that has been very like a lot of people have been saying is like, AI won't replace a physician, but a physician who doesn't believe in AI will be replaced. So I think that's a pretty good general rule, that if you're not adapting to those things, then you will find yourself left in the dust. But I don't think in general that I'm as worried, or maybe I should be. I think there are certain people who are very worried, like pathologists and radiologists are absolutely worried. But I still think I will trust a radiologist more than I will trust a computer. But that's hard.
Absolutely. I mean, at the end of the day, AI does mistakes too. Like if you look at it today, I won't say AI is the best option to go and look at things for. I mean, I'd rather go and ask an experienced professional who has spent many years in medical school than a computer. It's just a program. Like it can make errors too, and humans make errors. So what's the guarantee that a computer won't? So what keeps you choosing this profession every day?
Uh, right now it'd be really hard to choose anything else. So that's one thing, the practicalness of it. I mean, no, I mean, again, I ultimately at the end of the day enjoy what I do. And so it's good. I also have, you know, planned for the future. So, there are certain things that I still want to do, and, we'll see if that ends up coming to fruition or not. But at the end of the day, you have to like what you do, and or you're not going to be able to motivate yourself to do it. And so that's, the simple is, and the most easiest answer is, I still like it.
Okay. And also, AI, I mean, like when we talk about technology also, and patient care, I mean, patient interaction, do you think fear mongering, which is like non-medical professions actually making videos about what to do, what not to do, and all that stuff, do you think that affects patient doctor interaction? Like, do you think patients feel, or patients, I mean, obviously you're in pediatrics, so parents, do they feel unnecessary fear because of what they see in social media, and how do you think that has affected the interaction between you and the patient?
Yeah, I mean, when Dr. Google is at your fingertips, and you can always find something that feeds your narrative, no matter what you're doing, both on both sides, it is challenging to kind of meet in the middle. We see this in vaccine hesitancy in particular. I think that's the best example. We can't have patients who don't vaccinate because, a measles exposure would kill a patient who's been had as a transplant. And so for somebody to refuse the measles vaccine pre-transplant is a non-starter. And so we've had to do a lot. We've seen a lot more of that recently. And so, I remember, sitting down with that family and saying, and this is just the practical, like, you live in an area that has had measles, and you're going to see more of it because there's more people who don't want to vaccinate. And so this is the risk. And this is the risk on our side, because if we, give a heart to somebody who isn't protected from preventable disease or preventable mortality, then we've taken that heart away from somebody who would. And so, we have to do a lot of work with families to try to meet them where they're at. And so I think that's how you win those battles, is you just, develop the trust over time. And the confidence that they develop confidence in you as a physician. And then whether things are going well or not, you can still they can still develop confidence in you. And so that when you have to ask things that are against what may be out there in the social media or, public environment, or even family, it's now, oh, well, you gave your kid that vaccine. How could you, with your child that has this illness, so they're getting it from family members, friends, all the other things too. So you have to think about that. It's not just what they're consuming, it's what all the people around them are consuming. And so you just try to, make sure that you're the voice they're listening to. And so, and that only comes with taking the time to develop the relationships and do the hard stuff.
And there are a lot of AI generated videos as well, which talk about what you should do and what you shouldn't do and how it affects your health. Like, I saw this crazy video on how drinking water, like standing up and drinking water, can cause heart attack, which it just doesn't sound like it could happen, right? Because I know a lot of people who drink water standing up, and I don't see them getting a heart attack. So it's just crazy how people go around spreading stuff that's not true, and I don't think they are really aware of the consequences that, like, that affects people who are watching the videos. So yeah, I think social media and fear mongering should really stop. So what does wearing a white coat mean to you now? Like, what changed?
Oh, well, I don't wear a white coat. That's one secret. I think you see a lot fewer of them in the hospitals,
Yeah.
on the pediatric side. I think there's a lot of, we kind of, with pediatricians, you don't want kids to think of you as somebody scary. So that's, a lot of pediatricians don't wear white coats. I mean,
Oh.
I do think that, but obviously if I'm around, like, I want to, present a, kind of a expertise or kind of whatever, you will see me wearing them, like interviews and other things. But yeah, I mean, it has lost some of its luster, I think, again, as people struggle with, you know, healthcare in general. But for me, as always, was something that, you have to model, the it is looked up to, and you want to be that person that people can look up to it. And for me, that's what I always try to keep in mind whenever, when I'm, on the floor or in the clinic or whatnot, is that, you're trying to model what you think people exudes confidence as well as respectability and that piece. So yeah. But yeah, I'm typically not a white coat wearer.
Oh, yeah. I think that's another thing that social media and the medical dramas portray, that doctors, they're wearing white coats 24/7, going around and treating patients, and it looks very dramatic and feels dramatic. So I think people really need to know what a real doctor does and what's the difference between an actual doctor and a very dramatic internet doctor. So like I think that difference needs to be clarified, because a lot of people have a lot of misconceptions these days about medicine and how doctors are. So thank you so much for being here with us today.
No
I
problem.
think you've shared amazing facts, and it was very helpful for me, and I bet that it's going to be very helpful for my audience as well. Again, Dr. Castleberry, thank you so much
My
for being
pleasure.
here and taking the time, because the work you do is truly incredible and it's really important. Thank you so much for all that you do. Keep doing. You're doing an amazing job. Thank you so much.
No problem. Thanks. Good luck to you.
Thank you.